It was back in 2023. The Centers for Disease Control and Prevention launched a public service ad campaign to try and steer teens away from vaping in school. Let's take a look at that effort.
Is that a vape? Vapes are bad for you, so just don't do it. That won't work. I could just be friendly. Let her know I actually care. And that nicotine addiction can be one more source of stress you don't need in your life.
There's currently an epidemic now. There is a mechanical vape pen use epidemic out of the high schools where the children are. And so whenever you go into the bathroom, soon as you look up, you see everyone around. What are they doing? Everyone is hitting a vape pen. Everyone is hitting a wax pen. And what does it do here? It programs your mind, well, if everyone's doing this, maybe I need to do it. This is what deters us, the young people, from being able to elevate and strategize into the next level. Because why? Instead of focusing on our grades, instead of focusing on how are we going to get into the next income source, we're actually looking at, okay, where's the next time I'm going to be able to smoke? When is the next time I'm going to be able to leave the class? So one of the biggest temptations I'm seeing that's facing the young people now, I would say, would be drug use.
And joining us now, the Factor Uncensored, Dr. Donnelly Ali with Arch Point Pain Institute. Dr. Ali, you've heard it from parents, and you're hearing it from students as well. They're saying all the kids, not all the kids, but many of the kids in high school and middle school are smoking these vape pens. And we're not just talking about nicotine. In some instances, we're talking about cannabis or marijuana vape pens. What kind of danger does that put those kids into?
Yeah, Isaiah. Yeah, this is a very alarming trend that we're seeing, and with social media, with the ease of the use of these pens, and with the flavoring, the additives that these companies have been putting into these vaping products, we've seen a significant increase in the amount of use of these substances, to the point where, as this child was alluding to, that it's being done by almost everybody in schools, and they're going to bathrooms and taking these, breaks consistently to take a hit on their vape pens. And one thing he didn't mention was the sharing that's being done as well, and that increases the risk of infections and all these other things as well that we're not even discussing, beyond the fact of the nicotine use, the additives and the chemicals that these vaping products have, as well as the cannabis use. So the whole combination of all of this stuff, Isaiah, is very scary. It's alarming. And unfortunately, the trend continues to get worse and worse as folks are now, and these companies, these vaping companies, are coming out with newer and newer products and different flavors. And to be frank with you, a lot of these are becoming more and more in nicotine because they need to give more folks more of that high, more of that urge, more of that need to consume more and more of that product.
And when we talk about the use of these vape pens, and many people saw it as an alternative to smoking cigarettes, and obviously smoking cigarettes bad. Now we're hearing that vaping is bad, but what does it do to a young person if they're not only vaping nicotine, they're also possibly vaping cannabis or marijuana in those pens?
Yeah, Isaiah, what we're seeing is a lot of these, and a lot of the research is still ongoing from the long-term effects of this product. Obviously, it's been around, but we're still seeing some of the research that's being done to show the long-term effects of these, right? There's additives in it, there's metal compounds, there is flavoring as well. What are the long-term effects? And that's what we're really concerned about, is because we know that that nicotine product is there, and because of the ease of it and because of how much it's consumed now, we are concerned that this may be even more alarming and more detrimental for the long-term effects of these vaping products, because of the ease, because of the convenience, all the things that are being added into these products. And so this is definitely an alarming trend. And I think that we need to be talking about it more, and we need to be doing more about it. I think, is it safer? The answer is only long-term research will show that answer, but we know that there are harmful, very addictive things in here, and there's just the alarming trend of what's going on right now.
And we know from the latest statistics, I think it indicated 2.1 million young people around the country are vaping, and that would be middle and high school students, and at least 18% in high school and middle school here in the state of Texas. That should be alarming.
That's correct, Isaiah. And what we're not mentioning is the adults as well that are consuming these products, because what we're seeing is that the numbers are going up in the teenagers and college students as well. But we're also seeing these products be utilized with adults. And what that happens is that may also lead to other comorbidities and other conditions, like it affecting your heart, your lungs, your blood vessels. We already know as we age, we get more atherosclerosis or hardening of the arteries. And if we're adding nicotine in these vaping products, that's even more of a concerning and alarming sign. And that's what we're seeing, that trend increasing of other products such as vaping. And now these folks are now consuming and adding other substances into the mix. And again, this stuff is not FDA endorsed or approved or regulated. And so we don't know what are all the substances that may be consumed and may be in these products, Isaiah.
Yeah, we have to be very careful with the young people out there and check those backpacks before they go to school. Dr. Donna Shaw Lee, always good to talk to you here on The Factor Uncensored.